Good day, ma'am.
Good day.
My name is Francine Teotura, a student nurse from the University of San Agustin. So, can you please state your name, or may I please know your name and birthday, ma'am?
My name is Olivia Sway, and you can call me Mrs. Sway. And my birthday is on December 11th.
Okay, Mrs. Wei, today I'll be performing a postpartum nursing assessment. This is done to identify early signs of complication. Okay, this is specifically done to women who are at risk for infection, hemorrhage, and the development of DVT or deep vein thrombosis. So is that okay with you?
It's okay.
So I'll just wash my hands and be back with you shortly. Okay. So first, ma'am, is I will be taking your vital signs, ma'am. This is the pain um, uh, baseline data. So I'll start with your blood pressure, ma'am. Can you please take your coat off? Okay. And then after that, ma'am, I will have you assume the supine position with your knees slightly flexed. Okay, ma'am? Okay. So, ma'am, how do you feel?
I'm a bit nervous and excited at the same time to hold my baby.
Okay. Next is I will be assessing for pain and implement appropriate pain management because most women experience pain or discomfort in their perineum, and there are instances that it can be bruised or some stitches might tear open, and or if they feel any soreness in that area. So we assess the client by asking what is the scale of the pain they felt. 1 being no pain at all, and 10 being the worst possible pain that they felt. So, ma'am, do you feel, out of 1 to 10, how will you rate your pain, ma'am?
1.
You don't feel anything.
No.
How about soreness, ma'am?
Nothing at all.
Okay, thank you. After assessing their pain, we will be assessing her breast. So for this part, I will be donning gloves for safety and ask the client how does their breast feel. So how does your breast feel, ma'am?
I feel normal and I haven't experienced any changes.
Okay. So for breast, we will be assessing the consistency, if it is soft or engorged, and check if it is secreting or any sign of mastitis, which is an infection of the breast tissue. We also need to check for the size, if it is appropriate for her body proportion, and then its shape, as well as its symmetry, if it is symmetrical to each other. So, ma'am, I will be touching your breast. Is that okay?
Okay.
Okay. Her breast feels soft. The breast also is proportionate to her body size. Then it is symmetrical to each other, and there is no signs of mastitis that can be noted. Next is we assess the nipples. So this is to check if there is any redness, or if it is cracked or sore, if it is flat or inverted. So there is no redness I can note of. No cracking or bleeding is also visible. The nipples became erect with stimulation. And then colostrum or milk is present if the nipples are pinched. Next is we assess the abdomen, the uterus. So if the patient had a low segment cesarean section, we examine the cesarean section wound for union and healing. Then, since Mrs. Sway had a normal delivery, I will check their uterus for involution and the fundal height. I will be also observing for contour, distension, and appearance. Then palpate the fundus and feel for a firm globular mass and assess for fundal consistency if it is soft or boggy. And lastly, assess location, height, and measures in centimeter from fundus of uterus to the suprapubic line. So, ma'am, I will be palpating your fundus. Then your umbilicus, ma'am. Press in and downwards. And then we assess for the patient's bladder. So we asked mom when she last voided. So when did you last urinate, ma'am?
An hour ago.
Okay. Establish a voiding schedule to prevent bladder distension and urinary stasis. I encourage you to have a voiding schedule. This is to prevent bladder distension, which is the stretching of your bladder, and urinary stasis, which is a risk factor for urinary tract infection, ma'am. And then another thing that I could encourage you, Mrs. Wei, is to urinate every time you feed your baby. Next is we perform bowel assessment. So bowels is assessed for bowel sounds, return of bowel function, the flatus, color, consistency, and consistency of stool. So, ma'am, I will be listening to your bowels. So first I'm gonna warm up the stethoscope in my hand. Normal findings should include the bowel is soft and non-distended, the normal bowel sounds in all 4 quadrants, passing the flatus, and then bowel movements. Do you have any difficulty, ma'am, passing your bowel?
No.
Okay, bowel movements with no difficulty. So next is we assess the lochia and perineum for episiotomy and healing. So we assess the color, amount, and odor of the lochia, and then we observe for any hematoma and examine the episiotomy or laceration for RIDA, which is redness, edema, ecchymosis, discharge, and approximation of the wound. I will be opening your blanket. Ma'am, I will be lifting your blanket, ma'am, to check your lochia and perineum. Is that okay?
It's okay.
Then I will be checking your lochia, ma'am. Doon ko yung mga panties, ma'am. Okay. When did you last change your pad, ma'am?
An hour ago.
So, the normal finding here is rubra or dark red up to 4 days. And then, there is a moderate amount with an earthy smell. Okay, after 30 minutes, ma'am, I think we can change your perineal pad, ma'am.
Okay.
Okay. So, i-pull up kayo mga panties, ma'am. Next is we assess the lower limbs of our client for DVT or human sign and for mobility. So, ma'am, I will have you sit up, ma'am. At the face to side, ma'am. Then, we need to check if there is pain upon dorsiflexion or if there is calf tenderness. So, ma'am, I will. So, do you feel any tenderness in your calf, ma'am?
No.
How about the other side?
I didn't feel.
How about if we flex your feet? Do you feel any pain?
I don't.
And then the other side.
I still didn't feel any pain.
Okay. There is no. So patient doesn't feel any pain and there is no leg edema present. No visible color changes on both legs or feet. And then, do you feel any pain when walking, ma'am?
No.
Okay, thank you. Next is we assess for the emotional status. So, ma'am, do you feel any sudden mood swings when taking care of your baby?
No.
And do you know how to properly care for your baby?
Yeah.
Okay. So, do you feel, how about the emotional support? Do you get that from your family members, ma'am?
Yeah.
From your husband?
Mm-hmm.
Okay. Then we observe for blood transfusion or any postnatal complications such as hemorrhage, infection, or any other abnormalities and implement appropriate management.